Hello, everybody. Welcome to the latest webcast in Caring.com's Digital Marketing Academy. Our session today is focused on home care sales and marketing trends revealed in the latest Homecare Pulse benchmarking study. I'm Denise Graab, a marketing director here at Caring.com, and I'm joined by Kire Madsen at Homecare Poltz, who I'll introduce more in just a moment. Before we dive into the presentation, though, I want to cover a few housekeeping items. This is a one-way webcast where only the presenters speak. You can ask questions in the upper right of your screen anytime during the session. We'll have a Q&A at the end. And if we don't get to your question during the session, we'll follow up with you afterward. The number one question we get in every session, and I even got it before the session began, is will this be recorded? The answer is yes. You should see a flashing recording sign in the upper left of your screen. We are recording this session and we will make the slides available as well. And as attendees, you'll be among the first to get both the recording and the slides. All right. The sponsor of today's free webinar is Caring.com. For those of you getting to know us, and as a refresher for our partners, our organization was founded by caregivers for caregivers. Our flagship website, Caring.com, was created and launched in 2007 to equip family caregivers to make better decisions, save time and money, and feel less alone and less stressed in providing senior care to their loved ones. Today, millions of people come to our website to research and get referred to senior living and in-home care. In fact, we have one of the most comprehensive senior care directories on the web, and we're number one for senior care reviews online, with about 250,000 consumer reviews posted and thousands added monthly. In May 2018, we were acquired by Caring Holdings, a group of investors with over 15 years of digital marketing expertise. This transaction has enabled us to continue and expand our services to family caregivers and older adults and enhance our competitive position in the marketplace. Caring.com has been partnered with Homecare Pulse since January 2017, and our integration has been an excellent way for home care agencies to quickly build an incredible volume of great reviews on their listings. That in turn helps these agencies rank in our directory, as well as attract and convert prospective customers. Homecare Pulse regularly calls home care agencies' clients and collects feedback from them, asking their permission to share some of that feedback on Caring.com. For those who agree, the reviews then get pushed to Caring.com listings once a month. You'll see some home care agencies on Caring have over 100 reviews. That can happen when agencies have been using Home Care Pulse for a couple of years and opted into this program. You don't have to be partnered with Caring.com to participate, but you do need to have a Home Care Pulse account to get those reviews added to your listing. And then all the agencies that are participating get a trusted provider badge on their Caring.com listing and any Best of Home Care Award badges that they've earned as well. At the end of this presentation, we'll share both Homecare Pulse and Caring.com contact information for those of you who aren't yet opted into this integration that's been working really well for agencies over the past few years. Our featured speaker today is Kire Madsen of Homecare Pulse. Kire brings over 2 decades of experience in sales and customer success. After leading a regional sales division for a global consumer products company, Kire joined Homecare Pulse to head their customer success department. Kire has consulted with the executive teams of many of the leading brands in home care to help them implement data and improve their operations. And when he's not working, he enjoys spending quality time with his family. Here's a high-level overview of what we're going to cover in this webinar today. I'll touch briefly on some dramatic changes in the home care industry that Caring's Peter Dubé discussed in the latest Home Care Pulse benchmarking study. Then Kire will take you through the details of the study, including some key findings in their report for home care agencies, sales, and marketing. And at the end, as I mentioned, we'll have a Q&A and a special discount offer for those interested in getting a copy of the study. So don't bounce early, stick around for that discount code. And for those of you who joined a little bit late, we are recording the session. We will make the slides available. Now, before I hand over the presentation to Kire, I want to share some key industry shift insights from the benchmarking study that was published by Caring's Peter Drouet by invitation of Homecare Poltz. Some of you are very likely familiar with Peter. He has extensive experience in the home care industry, including helping to build both the Seniors Choice and Hallmark Home Care, two organizations through which he trained hundreds of home care franchises nationwide. In the Homecare Pulse study, Peter discusses how there's been some significant shifts in how consumers find in home care nowadays, including an increase in online channels for home care leads. He and I both also share with the industry the growing importance of online reviews in attracting and converting prospective home care clients, and how consumers are turning to impartial third-party sites more so to read those reviews. Peter recommends that agencies get a deep understanding of this new online shopper and expand your focus beyond your own website and professional referral sources to also include partnerships with senior care directories that are best ranking on search engines. You can read more of the insights Peter shared in the benchmarking study. And again, there's going to be a special offer for a discount on that at the end. Okay, now without further ado, let me hand over the mouse to Kire to present the Homecare Pulse findings. Okay, Kire, you can take it away now. Kire. Okay, just one second. We're having a little bit of a technical issue here. There we go.
There we go. Thank you.
There we go. No problem. Sorry about that.
No problem at all.
And then let me mute myself while you're speaking as well.
Okay, no problem. Welcome, everyone. We're so glad to have you on this webinar today. And thank you, Denise, for that amazing introduction. This partnership that Homecare Poltz and Caring.com has had since 2017 has been one of the greatest that I've ever been a part of. Both companies who are thought leaders in the industry and also wanting to, with a passion, help those that that are our customers and to grow their businesses. So this has been a lot of fun, and we're excited to have this partnership. Now, some of you may know who Homecare Poltz is, but I'm also sure that there's a few of you on the call here that have never heard of Homecare Poltz and who we are. And Denise, there's our little. Well, there we go. So, and now it's going fast today. There's Homecare Poltz has two different kinds of surveys that we do. Today, we're going to be focusing on the benchmarking study. The benchmarking study has been with us since 2011, 2012. It is a study that we partner with the Home Care Association of America on, and we gather data from agency owners, operational data. It's an annual publication. In this year's study, there's over 220 data gathered about home care providers. Now, the other type of survey, and this is probably the one we're most well known for, is our experience surveys. And that's where we're talking with clients and caregivers, gathering feedback and helping you understand the monthly pain points that either your clients or caregivers are going through and what they can do to basically overcome those pain points. So with that, kind of a little background, let's talk a little bit about the data we're going to discuss today and a little bit about the study. So as we go through this, you've heard from several different organizations that this year's study is probably the best we've ever done. And I think that comes from two reasons. First, obviously a phenomenal team made up of several different individuals who put the study together and did the legwork beforehand to make sure it worked out well. But two is a total participation that we had this year. This is the highest participation we've ever had for the benchmarking study. And we're seeing more and more people start to become data hungry, if that's even really a word. Right? They want to understand what's going into their businesses, making key decisions based on businesses. And so you can see kind of the makeup here of what the study is, the percentage of those that are independently owned, those that are franchise, those that are part of a larger hospital system or, home health Medicare certified business. So that's the breakdown of the data that we're going to be studying today. And the other key piece of this is way to look at the data is what was the revenue? What are the revenue ranges? It's one thing to say, yes, you're in my industry, but are you a similar size to what I am? Because let's face it, those who are doing $5 million or more in a year, which we term as masters, the way they conduct their business and their numbers should be drastically different than those who are doing under $800,000 in business. And so it's good to see a good participation across all revenue ranges. And what we're going to do is actually discuss some data today that will allow you to look at that and say, okay, I'm in this revenue range, so this is the median number of where I should be at. And again, we may not have all the answers for you, but data gives you the opportunity to ask the question, why? Um, let me just jump in here and let's look at our first set of data. So as we go through, the first thing is revenue. Obviously, that's one of the key metrics you should be watching is what your revenue is. So as you go through the revenue this year, you can see that we're seeing increase, right? Overall, I think it's about 11% increase over the last 5 years. I will be the first to admit that with COVID-19, there may be some interesting things that happen this year, and as far as revenues go and things like that. But we'll be watching that closely. In fact, we actually, because of COVID-19, we're able to do a partial study and measure some of the impact of COVID-19, and we've included that in this year's benchmarking study. For those of you who have it, you can go look at that, or if you're interested in looking at it, we've actually included some data that we did specifically around COVID-19 in this year's benchmark study. So again, revenues are increasing. Given some COVID-19 and some crazy things happen there, we still talking with different partners and large providers and small providers. We don't see that changing. We still think that home care is a booming industry, and there's going to be plenty of opportunity for everybody moving forward in the future. See if I can get there we go. Okay, so back here. I apologize here. I am apparently not an efficient mouse worker. There we go. Tracking industry comparisons or tracking inquiry tracking comparisons. I've always been told that success leaves clues. So what we wanted to do is track the percentage of those who are tracking every inquiry versus those that aren't. And it's actually increased. Those who are tracking has increased a little bit over last year. But if you look at the difference between those who track every inquiry and those who don't, it's almost $500,000 in median revenue. Okay, so I know there's going to be some outliers that go both ways, but that's why we use the median. So if you want to increase your future revenue and success leaves clues, then you probably ought to, if you're not currently tracking your ratios, your inquiry tracking, you probably ought to do that. But it's more than just tracking it. It's more than just saying, yeah, I want to use this data, or I'll get to it someday. You actually have to use the data. Data doesn't do any good if it's tracked but not measured or not looked at. So who's reviewing your inquiry management once you get it in place? Who's responsible for getting your close rates up if they're not where they need to be, right? The study will actually go through not just tracking every inquiry, but what are the close ratios that people are getting by revenue size? And if you're off from that, what do you need to do to get back to there? Who's in charge of that? Who owns the data? In this year's benchmarking studies, one of the authors quotes a W. Edwards Deming, and he says, without the data, you're just another person with an opinion. And that's really what it comes down to, is you can think about it all you want, but the data has to actually back up the decision and why you're doing it. So you don't necessarily want to just wish you were where somebody else is. You want to wish you were doing what they did to get there. I hope that makes sense as we go through that. But success leaves clues. So if you're not currently tracking and you want to improve your business, I would start here. It's not a guarantee, but success leaves clues. Those who are doing it are obviously making considerably more money. Okay, so let's talk about referral sources and referral marketing. Um, Interesting enough, you know, is that clients are, again, the top referral source. So that's a huge percentage of revenue. 73% of those surveyed said that they got, or 73% of the revenue came in. 22% of them recognized as a top source, but it accounted for 73% of the revenue. So it really kind of goes to show how strong of a source client referrals are. Um, when you get a referral from a current client, they tend to be a better fit client who stay longer and are a little less price sensitive and want to shop you as much. And I would also say the same goes with caregivers. Um, that's not a slide that we have in here, but I would definitely say, a referral from an employee tends to go a long ways as far as retention and less price sensitive to jump for you as well. I would look at where you are getting your most referrals on this chart and how much money are they providing to you. Now, I'm not saying that, if you're getting 80% of your referrals from physicians' offices, that's a bad thing. We're just displaying the data that, clients really are the key for getting some of your referral sources and putting that data in there. The next thing we want to talk a little bit about as we go through this is the consumer marketing resources. Hey, it's interesting to know as you look through this. First and foremost, congratulations to Caring.com. They made the top 10, but they have a strategic role, and we're going to show that here on the next slide and the opportunity that they provide for you. But the thing that really kind of stood out to me was the Facebook piece as well. Agencies that can crack the code on getting a return from Facebook are really seeing it pay off, but it takes time and it takes effort. But that was one thing that really kind of stood out to us on the consumer marketing resources. And then obviously, again, congratulations to Caring.com for making the top 10. Now, we talked earlier a little bit about success leaving clues. And ultimately, I think most of you on the call would say that your goal is to grow. So let's look at what those who are doing, what are the masters, those that are making over $5 million, what do they use for their consumer marketing sources? So what did they say? And there we go. So Caring is number 4 on their list. So it makes the top 10 for the industry, but when you get into the masters, Caring is number 4. So again, lots of internet, right? Everything's on here, internet. If you don't have a strong internet presence, you probably ought to take a look at that. What could you do to improve your SEO, different things like that to help attract those new leads and increase your revenue there. Okay, so going from the consumer resources here, let's talk a little bit about client acquisition costs. We're seeing the cost of getting new clients increase. That happened significantly back in between 2016, 2017. I would say margin of error has been fairly flat, so it is up a little bit this year, but we have got some good news for you as well. For those of you who are experiencing this in your business, you'll also like to see the fact that the average lifetime value of your clients is going up as well. So sometimes I'm seeing there we go. Sometimes I see that, and sometimes it's not there in the bottom for me to click. So so the only area that didn't increase from 2018 to 2019 were offices that were doing under 800,000 per year. So the larger the revenue size, the larger the average increase, lifetime value increased. So I would say, again, going back to it is not always, but in most cases, the larger the agency, the better prepared you are to say yes when an opportunity comes along, and the more resources you have available to you in order to make your clients happier. So all of that is going to go into customer satisfaction and helping those clients stay longer. And I think that's why you're seeing the increase across the board consistently along the larger corporations. So a question for you is, how did your year-over-year numbers look? Did your average client lifetime value, did the revenue from that change? Did it increase? Did it decrease? One thing that you want to look at this is, how do you actually compare apples to apples? And so what I would do is this: I'm going to share you the calculation that we used for the average lifetime value. And so we take the annual revenue for the 2019 year, divide that by the number of clients serviced, and then times that by your annual client average length of service. You can find this calculation on page 129 in this year's study and kind of go through and see how you rank and compare across the board to other offices out there and what they're doing. The other thing that was kind of interesting this year, as we talk about increases in your overall cost of client acquisition, but being offset by your average lifetime value, is the sales and marketing. We jump into some of the sales and marketing expenses here. So we've across the top, we've got your median annual revenue, so you can kind of see which bucket you would loop yourself into. But as we get into sales and marketing expenses, I think it's important to see how this kind of flattens out as your agency grows. And I think we've kind of consistent with that, but across the board, you can kind of figure out who your target markets is, what's working, what's not. You can kind of target and spend directly to your audience. So if you're significantly higher in your sales and marketing expenses, a couple of things that I would do first. One, make sure that your books are correct. Make sure you've got your expense categories for sales and marketing lined up in your QuickBooks or whatever program that you're using. And then if it's still higher than that, it's probably a great time to have a conversation. What is your client acquisition cost? Right? If they're going up, does that, what are your sales and marketing expenses doing? And just making sure that your numbers are kind of in check. I say that because all of these really kind of tie together, right? Your client acquisition cost, your sales and marketing cost, they're all lumped together. And that's why it's important that you keep track of your information. Whatever systems that you have, can you tie these numbers back together and understand what's happening in your business? Again, this is a great reference point. That's why we put out the benchmarking study, so you can see what others in your revenue range are doing. And if you're off, then it's important for you to do that and double check your numbers. I can't tell you how many times I've owned other businesses outside of this, and you sit down with the accountant and you ask the question, why did this happen, or what happened here? And ultimately there's a bookkeeping error, or this happened. You go back and change it, make sure it's right, get it back on track for what you're expecting it should be. The other thing, and again, this could also go into sales and marketing expenses this year, is the increased effort from hiring more sales reps. So just looking specifically at this line of the sales reps, this is a huge change from years in past. In 2018, the average agency wasn't bringing on a sales rep until they hit 1.6 million. Okay, so they weren't even starting to get a sales rep until they hit here. And now they have 2. So agencies what we're seeing is they're hiring twice as many sales reps as they used to. Okay, so that's going to affect your customer acquisition costs. That's going to affect your sales and marketing expenses. And so understand where you're at. What does your business need? Now, I'm not saying you need to go out and hire 2 sales and marketing or to marketing reps here at 1.6 million. I think that's an individual basis. But according to those that we've surveyed this year, or that participated in the survey, that's what they have. That's what they're doing in their business right now. So I think those are some really cool key points as you're looking at your business and how to structure it in the future. Okay, so we've talked about revenue, we've talked about acquisition cost and marketing expenses and the lifetime value of a customer. Where's the money coming from? Right? I mean, that's really the question we should be asking ourselves, is where's the money coming from? And so we put together this payer source. Whoops, I am quick mouser here today. I apologize. Here we go. So which payer sources are our agencies relying on? Obviously, private pay is dominating that, and long-term care. But it's interesting as you look at this, your private pay, again, it's probably within the margin of error, but it looks like it's going down a few percentage points. Same with long-term care, and you're starting to see increases, again, slightly, is billed Medicaid, Medicaid waivers, and managed care organizations are on the rise. And I think we'll see more and more about this going forward. We actually, one of the questions that we asked is, in our survey is agencies that benefited from Medicare Advantage plans in 2020, and were they planning to benefit from that? And I would say the jury is probably still out a little bit on this. Obviously at the end of this year, we're going to have some more data for you in the 2021 survey. But 46%, 41% didn't really know. 20% said, yeah, let's do it. And almost 40% said, I don't know. So again, transition period in time with Medicare Advantage, but I think 2021, after we get this year behind us with a few asterisks for COVID-19 to see how that plays out, I think will give us a better idea of payer sources in the future and kind of where they're headed for the home care industry. So if you're not sure where you're at on Medicaid Advantage, it's a great opportunity to ask the question. If you're not planning to participate, no worries. We've heard from a lot of folks that they're excited about it. We've heard from others that they're not. So I think it's kind of a personal preference of where you want to be and how you want to run your business going forward. So, okay, we've talked about, several different things today. Again, these are just highlights from the benchmarking study. And what we're highlighting here today won't necessarily, be the data that your business is looking at. So that's why it's so important for you to, look at the study for yourself, see what are the key metrics that you want to look away. But as we look through it, here's the key takeaways for us. One, tracking every inquiry is a simple component to optimizing your growth. Two, when it comes to referral sources, past, current, uh, in the past, current clients are the heavy hitters. It's becoming more expensive to acquire clients, but you're also getting more revenue for each one of those. And then last, agencies are hiring twice as many sales reps as they used to. I think it's real quick is just, encourage you to take a deeper look at your numbers. How not are you comparing to the industry, but how do you compare to agencies of similar size? And if you're someone that's not sure, what numbers you should watch for in your business, there is a great article in the study this year that was actually done by Stephen Tweed. I'd encourage you to take a look at it. He gives 7 different key numbers and why you should be looking at them and what they mean for your business. So it's a great opportunity for you to, if you're new to data, to dive in. If you're old to data and you love it and you use it to make decisions, great. Keep doing what you're doing. But I'd highly encourage you to take a look at those, what are those 7 key numbers that he's recommending. Great article in this year's study. So with that, Denise, I kind of turn it back over to you.
Okay, great. Thank you, Kire. We had actually a couple questions so far, and folks, feel free to add your questions as well. Let me just grab the mouse back. There we go. Okay, so one thing that came up was Kire mentioned Facebook as a top source, as an interesting data point. Shameless plug, we're having a webinar on Facebook marketing next month for home care agencies. So sign up for that if you're really intrigued about that opportunity that Kire mentioned. Okay, in terms of questions, Kire, can you repeat, please, the calculation for the lifetime value?
Oh, absolutely. Let me just pull it up here. Make sure I always write these things out because I never want to miss it when we're doing this. So the average lifetime value is the annual revenue. So your 2019 revenue, you divide that by the number of clients serviced in 2019, and then you take that number and multiply it by your average length of service for your clients in 2019.
Average length of service.
Yep.
Okay.
And for those of you who have it, again, it's on page 129 in this year's study.
And I also just captured it in the chat box as requested
Oh,
by that agency representative.
perfect.
Okay, we also got a question about the revenue over a 5-year period and your opinion on whether or not you think 11% growth over 5 years is keeping up with the cost of living.
Again, without data, it is just an opinion, and I think it depends on where you live in the country. Again, so what we're surveying is the entire country here to get these revenue ranges and what they're where they're at. I can tell you that my friends in California and New York probably don't think that it is, but other parts of the country would say yes. So I think it kind of depends on where you're at. And again, this is a median number. There are outliers of folks who have much higher than 11% growth. And you can see, there was a big jump from 2017 to 2018 in that data. A small dip, a 0.8% decrease in 2019. But I think I see, personal opinion again, I see that this industry will continue to grow. Everything points to, talking with the Home Care Association of America and different partners that we have, that we're actually, home care is the answer going forward, to help reduce some of the costs and things that are going to be hitting our country, and that nobody can compete with home care when it comes to costs. So yes, I think revenues will continue to grow up, but as far as where you live and that percentage, I think that's a personal question.
Great. Thank you, Kire. There's also a broader question, not sure that it's covered in your data, but we'll see what you think. This person is interested in your thoughts on looking at digital marketing and the internet opportunity. What do you think is the most effective call to action? Phone calls, lead generation, website traffic? They're curious in your perspective based on the data that you've compiled.
So I would say that would probably be a better question for our marketing team and the
Okay.
research that they've been doing. We can tell you the data from the study and what it has. Let me see if I've got the study here in front of me. So let me just, and we're looking specifically at sales and marketing expenses, like
Yes.
opportunities, or are we looking for caregivers? Which,
It's,
is there a specific piece they want?
it's consumer.
Consumer. Okay. Let's take a
And
look
while you're
here.
looking up that, there was a question about reviews that I can answer
Okay,
that.
perfect.
So the question is, how do we utilize older reviews that are on Facebook and Google and post those to our caring.com profile? On caring.com, we seek original content in the reviews program. So we don't want reviews that are published on other websites, and we definitely don't want employees of the agencies copying and pasting reviews from other websites to their own listing. We decline reviews on caring.com that are posted by employees of the business. We are looking for consumers to submit their own review directly to us or through the Homecare Poltz program. But that is actually a question we get a lot. And in our reviews webinar, we talk about ways that you can get reviews from your clients, even if they've added them, if they've given feedback through other channels. We also, in the last one, did shared some study data on how, contrary to perception, that baby boomers and older adults are definitely visiting multiple reviews websites and participating there. It's not just one site that they're going to. Okay, and while Kyra's looking up data, we also, Peter Drouet is on the call. So we're welcome, Peter. We're glad to have you here. I shared some of his insights from the benchmarking study early in our presentation, and he had some thoughts on the digital marketing question. His feedback is, the value of the call to action is based on how each channel is set up. If your website is not converting well, don't send them to your website. If you don't have a good phone team, don't send them to your phone, etc. Hopefully that provides some guidance to the individual who asked about that as well. Oh yes, great. Thank you for the instant reply that did help. Awesome. Okay, Kyra, was there anything else you wanted to add from the study?
No, I just went through that. We didn't necessarily have anything on call to actions as far as
Okay,
conversions for that. So thank you,
okay.
Peter. That was well said.
Great, thank you. And then, so there was a question about, can you explain, just touch again on the benefits of purchasing the 2020 benchmark study?
Obviously, the one is being able to have the data and to utilize it, make data-driven decisions on it. That's what we see most folks use it for, is they want to understand where they're at compared to the competition, how their competition's using that. And I say competition because they want to know kind of where they're at for their business. Everyone loves to see, is this good or is this bad? So understanding how to make data-driven decisions, and then also understanding how you're faring compared to your competitors.
Great. Okay, let's see if any more questions have come in. And then some of the questions about specific to the Caring.com reviews program, I'm happy to follow up with you after. Specific to your listing, I can research those specific cases, including the various timelines for when reviews are processed on Caring.com.
Yep.
And if a consumer submits a review and we decline it as their notification, I can go into all that detail with you directly. It's a little bit off subject for this particular presentation. And you did get a cost of, you got two more questions about this study. First, well, three actually. What is the official name of the study? What is the cost? And what else is in it besides what we've covered today in this webinar?
Absolutely, that's a great question. So let's cover those. let's
Should
put
we
this
move
up.
forward to the next slide?
Yeah, let's do that.
Okay, great. All right, so do you want to go ahead and talk, Kire, about this?
Yep, absolutely. So first and foremost, the official name is the Homecare Benchmarking Study. And you can go to benchmarking.homecarepoltz.com, which I am trying to pull up right now, but I don't know why my internet is having issues here. See if it actually pulls up. There we go. It is available. So the cost of the study, if you want a hard copy, the cost is $449, and if you want a digital marketing, like you can download, $399 is the cost on those. We've talked about a couple of high-level topics, like we've hit like 4 or 5 bullet points. This study, like I mentioned before, is 220 pages long. We're going to cover sales and marketing, recruitment and retention, finance, operations, technology. We'll talk about the client caregiver experience and what you can do to improve that. And I mean, amazing articles written by people like Peter, Stephen Tweed, our CEO, Eric Madsen, our chief operating officer. We've taken industry leaders and got their thoughts and insights on each of these topics as well. So 220 pages of data-driven decisions.
Great. And then there was a question if the study has a budget breakdown between advertising for recruiting of caregivers and advertising for new clients.
Let's see here. I'll have to get back with you on that one. I don't
Okay.
know. If you want to reach out to me personally after the fact or get me the contact information, I can follow up on that one.
Okay, Peter just chimed in that he highly recommends the benchmarking study and that it definitely includes information about budget for advertising for caregivers versus clients. Thank you, Peter.
There you go.
Okay, and then here you see on the slide that there's a special discount. When you in the follow-up materials that I send to everybody, I'll include a link for where you can get the study and dive into all that data. And the other data that we didn't have a chance to cover today. Using the code CARING20, you'll get a 20% discount. Thank you to Homecare Poltz for graciously offering that. We appreciate it very much.
Absolutely.
Okay, great. And I'm not seeing any more questions specific to the study. And if anyone has any afterward, we're happy to follow up with you. I just wanted to let people know, well, first of all, we want to thank you, Kire, for taking the time to share this data with us. Thank you, Peter Droubet, for joining us as well and sharing your thoughts on the digital marketing opportunity. We will be following up with everybody, and we have a whole series of webinars, including a training series that Peter does for home care agencies. Here's how to reach our team. We are going to be prompting you to actually take a survey. We want to hear how you liked this webinar, what you'd suggest for the future. And we also, there's an opportunity to opt in to be contacted by Homecare Poltz. Please look for that link. As soon as I end the session, you'll be getting it. We hope you'll share your feedback. We really care about your thoughts, and we look forward to hearing from you. Kire, is there anything else you wanted to add before I close the session?
I just say I appreciate everybody coming out here to join the webinar. I know 2020 has been kind of a crazy year for you, and we're looking forward to closing the year out strong and seeing you on future webinars.
Great. Thank you so much. And thank you, everybody. I hope you have a great rest of your day. Look for the email from us tomorrow morning. Have a
Thanks,
great day.
everybody.
Bye bye.